I'm Dr. Aniruddha from Toothpicks Dental Healthcare. I'm using my son's toy today as a model because I don't have the sophisticated models that I have in the clinic to show you today as I'm at home. Now, what are the basic things that you need to have in your dental kit is what I want to discuss today. First of all, you need to know that the first thing you do in the morning is brush your teeth, right? You brush your teeth with your toothbrush. Now, when we brush our teeth, we have to make sure that our brush is clean, it's washed, it's kept clean, it's dry, it's got a flat surface, and it's got a very smooth bristle. Alright? Please don't use a very hard bristle toothbrush and try to scrub your teeth. It may damage your teeth. So it's very important that you use a very soft toothbrush, and only if your dentist prescribes you otherwise, you can change your toothbrush bristles depending on the requirement. Toothbrush is used to clean different surfaces, the outer surface, the inner surface, and all over from your back teeth to your front tooth, the upper teeth to the lower teeth, and so on and so forth. Now, other than your toothbrush, the other important thing you require is a tongue cleaner. Alright? So the tongue cleaner that you're using is very important because your tongue will have a lot of deposits. It will have debris. You may see a white layer covering your teeth, or your tongue, or a yellowish layer covering your tongue, which will result in bad breath, which will result in so many other complications related to oral cavity, and therefore it's very important that you use your tongue cleaner to keep your tongue clean. Now, if you don't have a tongue cleaner, you can always use your toothbrush to brush your tongue surface, and keep your tongue clean so that there is no bad breath, there is no debris on the tooth surface, so on and so forth. Other important thing that you need to remember is to carry a dental floss. Now, in between the tooth surface, your brush will never reach inside, right? There are two surfaces touching each other between two teeth. So this surface and this surface needs to be clean. How do we clean? We can clean it with a floss, right? So the right technique should be used. The right technique of flossing should be used so that we don't damage our gums, don't damage our teeth. And it is very important to remove the interdental debris or interdental bacterial growth, or what is called biofilm. The whole concept of brushing is to remove the biofilm on the tooth structure, is so that we don't develop caries and we don't develop gum diseases. So that's very important. Now, we use a floss only when we can't use interdental brush there. So interdental brush is one of the very important aspect of oral hygiene practices. There are new researches, new sciences behind this, and it should be scientifically measured by your dentist and prescribed to you, and you have to use that particular interdental brush once a day so that you can keep the interdental spaces clean. And the difference, some of you may be complaining when you brush your teeth, you have bleeding, right? So that's not normal. When you're eating something, you have sensitivity. That's not normal. So all these things can be prevented if your oral hygiene practices are good. Okay, what other things you would require? You may require a toothpaste. Toothpaste can be of your choice. It can be, of your choice of flavor or the type of brand that you want to use. But as much as possible, make sure that your toothpaste has got less abrasive. When you use a toothpaste with more abrasive, what is going to happen? The enamel on the tooth surface is going to be lost, and you're going to have sensitivity and other complications later on. So it is very important that you carry these things in your kit. Make sure whenever you're traveling, whenever you're at home, you have a separate kit for your dental hygiene materials, because you have to keep these things very clean, and it's ideal that you change your toothbrush once in 3 months, or whenever your dentist prescribes you to change your toothbrush. And it's very important that you get your dental checkup done once in 6 months so that you don't end up with a more complicated dental situation. Thank you very much.